And with that, I'm going to ask Dariusz Dudek to join us to talk about the extended follow-up of the MAGICAL trial.
Good evening, and thank you for invitation. We have some evidence for the MGuard stent system with some data. However, I was encouraging that we should do also the long-term safety and efficacy of MGuard stent system in ST elevation MI, and that's why I was really encouraged to organize the long-term follow-up for the MAGICAL study. As you may remember, the MAGICAL trial was the one of the first registry which were published in Eurointervention, and we were focused on the myocardial reperfusion with the excellent results for the TIMI-3 flow, myocardial brush grade, and complete ST resolution. When we were looking for the MACE at 6 months, it was a very low rate of events, so it means that all these patients were treated in a with the good clinical outcome, and also with the good myocardial perfusion parameters. So we're thinking how to go and to look for the long-term data for the 60 patients which were enrolled to the MAGICAL study. So that's why we decided to look for the long, more than 3 years follow-up of these patients which were enrolled to MAGICAL study, and also to look for the long-term LV function to see if we have the negative remodeling after the primary PCI, or we will see the preserved function if the myocardial perfusion was so good. So it was very exciting for us to do in a short time, to contact all the sites which were responsible for enrolling the patients to the registry. And we were just contacting these patients and looking for the long-term follow-up following the 6 months period, which was in the first report on the MAGICAL study. So looking for all kinds of the major adverse cardiac and cardiovascular events, which were adjudicated by independent clinical event committee, and also we decided to check with echo the long-term result of these patients. So the patients which were enrolled were mainly between the 2008 as the 6 months follow-up which was published, and 60 patients. And now I will be talking on 57 patients because 3 patients were lost to follow-up. And we did in 50 patients we did 50 patients the post-procedural echo, and we have in 46 documented recent echo after 3 years. So we have some PERT analysis also for these patients. When you look the data after 3 years, so I think that it's very amazing to see that we have so low the cardiac death after 3 years, which is 7%, with the non-cardiac death, which is 2%. Target lesion revascularization, because many people are concerned that the stent is a bare metal stent, so maybe many patients, they will need the repeat revascularization. So we see that for the 60 patients, it was only one, the TLR or TVR. And I think that this is a confirmation that in terms of the clinical follow-up, you don't need to be worried on the recurrence of the symptoms with the stent. Concerning other safety and important endpoints for your patients, so ischemic stroke occurred in one patient, which could happen during the long-term follow-up for the patients after primary PCI and very often diffuse atherosclerotic disease in the body. There was no episode of re-MI, and what is very important, we didn't find definite or probable stent thrombosis. So in the total, the MACE rate after 3 years was 8.8%, and for including the cardiovascular all events, cerebral vascular events, it was 10.5%. When you look for the Kaplan-Meier curves, so we have the line at the 3 years, so you see that the survival is a very good one. And as I said, it is at the level of 93% with the 7% of the mortality. And you see that the curve is pretty stable and good. When you look for the all MACE events, same results up to 3 years, no problems with patients after the stenting in this registry. And also, as I said, we're looking for the LV function and post-procedural long-term follow-up, and also we're looking for the left ventricular end diastolic dimension. So the end diastolic dimension didn't change, so it means that we didn't notice the negative remodeling, so no enlargement of LV volume, and also the ejection fraction was preserved. We can say that even we see even higher numbers with the long-term follow-up, but certainly maybe it's exaggerated, but we can say that the LV function was preserved for the next 3 years after, more than 3 years after the primary PCI, and no enlargement of the left ventricle, which means that there was no negative remodeling of LV, which is probably a matter of the good reperfusion during the primary PCI with this technology. So I would say in conclusion that the long-term data at 3 years with the MGuard in STEMI population in the medical study are showing the 7% of cardiac deaths, the 10%, 10.5% of MACE, preserved LV ejection fraction, and also the LV diameters, so no negative remodeling. The LVs are good of our patients. So early safety and efficacy of MGuard is maintained in the long-term follow-up, so I'm happy to see these results, and I was really impressed with this data within this more than 3 years, and I'm pretty sure that, and I hope that the master trial will be also so positive. Thank you very much.